Hello, everyone, and welcome to the first webinar of our Nutrition Wellness series. I'm Amy Leitman. I'll be your moderator for today's session. I'm the president of NTM Info and Research. We're here today with Michelle Macdonald, who is a clinical dietitian and certified diabetes educator at National Jewish Health. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, as well as overweight patients, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with multidisciplinary teams of specialty clinics, counseling both inpatients and outpatients. She is dedicated to helping patients use nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. Most of you remember Michelle from our previous webinar last fall, where she presented on nutrition, and we are bringing her back by popular demand, and we're very excited to have her here today. And this will be her first of 6 webinars this year, so we look forward to welcoming you back for more. So today, our format is going to be the presentation followed by a Q&A. You can type your questions by hitting the Q&A icon at the bottom of your screen. And the questions will go into the Q&A box. You hit send, and the questions will show up. At the end of the presentation, I will start reading the questions for our speaker to answer them. Don't forget about our upcoming presentations. We have our second in the series for mental well-being on July 18th with Dr. Devin Smith, and our second in the nutrition series on August 8th. Don't forget to follow us on social media and learn more about us and sign up for the latest news on NTM Info and Research. Michelle, welcome. Thank you for being with us today, and we look forward to hearing what you have to say. Take it away.
Thanks, Amy. And welcome to everyone who's joining. It's strange not to see faces on the screen, so I'm just going to pretend like I have an audience. So I'm going to dive right into the topic, and I'm really happy to support Amy and NTMIR because they're a great organization, and I appreciate the opportunity to actually provide what I think to be the best nutrition messages at every opportunity I can. There's a lot of competing and conflicting information out there that we all have access to. So I really try and be thoughtful about what I say and how I say it, and I try and be realistic and reasonable. And so I hope this is helpful. I think we'll have a chance to interact for a number of webinars coming forward. So maybe we can start with this and build moving forward with the information I provide and the feedback that I get from you today. Okay, so in terms of an overview, I always like to start with a background. And since the topic is an anti-inflammatory diet, I did want to actually give some background on inflammation. So we'll look at inflammation. We'll look at acute versus chronic inflammation. And we'll also talk about inflammation in the setting of a lung infection, which is what I think most of you are dealing with, and without, because it's typically because they're different situations, and I'll explain that more going forward. And then we'll get to the topic, which is an anti-inflammatory diet, and there is merit to this idea. So I'm happy to present on it because it's been a little bit controversial maybe in the past, but I think there's good evidence that suggests there is a link between what you eat and the inflammation in your body, particularly the chronic inflammation. So we'll look at the food and inflammation connection, and then I will dive into the quote unquote diet. There's not necessarily a template for the diet. It's more of a pattern, and you'll see that. But I do try and give you some specifics because I think people want specifics. So let's start with the background in terms of what is inflammation. I think it's important to know that it originates with the immune system, which is your body's defense system. So when the immune system is triggered, that's when inflammation occurs. It is a cascade of reactions involving many different immune cells that will release various inflammatory compounds in order to progress the immune reaction or response. Inflammation is really the body's natural response to protect itself against harm. It's an essential survival mechanism that helps fight off pathogens, bacteria or viruses, as well as repair injured tissues. So it's a natural response that starts with the immune system. People typically talk about inflammation in two ways. It's either acute, which is short term, or it's chronic, which is where the anti-inflammatory diet tends to come in to play. So in terms of an acute inflammatory process, it's short term. It typically occurs immediately with an illness, like an infection. I'm getting over a cold virus, or it could be a flare of your lung infection, or it occurs immediately with an injury. Could be an ankle sprain, could be a cut or something like that. And it typically is short term, so it lasts a short period of time, maybe hours or days. And what happens is the body will sense that you are sick or that you're injured, and the immune system will actually send out SOS signals. Think of them as like 911 calls. And these are like, it's an emergency call to summon emergency responders, which in this case would be other immune cells. And essentially, your body's going to fix the problem. You tend to become symptomatic when this happens. And if you have an injury, you might notice pain, you might notice redness, swelling, or heat. If you have an infection, like a lung infection, or like a cold that I have or had getting over, you might have fever, you might have chills, night sweats, cough, sputum production, weight loss. Those are telltale signs that you are inflamed and that you're fighting something, that your body's fighting something. Other features are that it's healing and it's helpful. This response is good. Remember, it's a survival mechanism. So it's going to restore your health. Without this response, without this inflammation response, simple things could actually be fatal. Another important feature is that it tends to go away and then your immune system goes back to normal. So this is as opposed to, or acute is as opposed to chronic. Chronic is a longer term process. It may begin like acute inflammation, but it tends to persist for months or years, and it may damage cells, tissues, and organs. So features of this is that your body might again sound an alarm. It senses a threat. So it sounds an alarm, sends out the emergency signals, causes the inflammation to happen. The difference here though is that the emergency state really continues. It doesn't stop. And so the active inflammatory compounds in your body that were triggered tend to remain there. This may happen because number one, and you may relate to this, your body cannot get rid of the problem, meaning your lung infection persists. You've just suppressed it, but it persists. Or the body's activated too often. So maybe you have recurrent infections. They keep coming back somewhat frequently. That may cause chronic inflammation related to the infection, say, as I'm trying to make this relevant to you. It may also occur because your immune system, number two, misfires. It thinks that there's a threat, but there's actually not, but it acts like there's a threat. And this might be an example of this might be an autoimmune condition, celiac disease, for example. Your body thinks there's a threat and so then attacks your intestinal lining. Or lastly, and this is where an anti-inflammatory diet comes in, diet and lifestyle diet and lifestyle factors could continually trigger an inflammatory response. So other features, you may not be symptomatic. So, or alternatively, you may be asymptomatic. So this process may be silent, you may not feel it. It's rarely helpful, like the acute response, and it may be harmful. It's been linked to chronic diseases that we think of kind of as the bigger killers of the Western world: Alzheimer's disease, cancer, diabetes, heart disease. It also does not go away, and the immune system does not go back to normal. So basically you have this long-term issue that's ongoing. Okay, so in in both acute and chronic inflammation, I thought it might be helpful for you to know that this can actually be measured in your blood. So there are what we call biomarkers. They're measurable substances in your blood that indicate high or low levels of inflammation. A couple examples of biomarkers are the C-reactive protein, or CRP, and the erythrocyte sedimentation rate, or ESR. There are many others. And typically when individuals come to National Jewish and come into our infectious disease clinics, we will actually typically draw the CRP and the ESR for an evaluation of their inflammatory state. We draw other markers as well. These are just some of the common ones, or a couple of the common ones that I thought you should be familiar with. So when you look at your lab work, you have an understanding of maybe what it means. Okay, so the point I want to make, I want to kind of distinguish if you have a lung infection and a disease-causing bacteria like NTM or Pseudomonas, which is common with bronchiectasis, if that's causing acute or chronic inflammation, then the most effective treatment is not diet per se. It's likely antibiotics and respiratory therapies, since these have been demonstrated to be very effective at directly suppressing and removing the bacteria, which is the source of the inflammation. So in order to treat the inflammation in this instance, when you're having an acute flare or if you have recurrent ongoing issues, then it's really to hit the inflammation head on, which is the root cause of it, which is the infection. Diet will only potentially play a supportive role here. And so this is a little bit of a repeat, but diet will have a minimal impact in getting rid of your bacteria or inflammation in this case. It doesn't mean that it's not important. Good diet has actually a very important role in that it will help you maintain a healthy weight or help you restore weight that you have lost if needed. It will provide key nutrients like vitamins, minerals, and omega-3 fats that are well known to strengthen your own immune system's ability to fight off the bacteria. And it may also help protect your lungs from getting reinfected. And what I mean here is we have a big focus on following diet recommendations for reflux so that you're not resoiling your lungs and potentially causing more inflammation from the direct aspiration of the reflux or re-inoculating your lungs with new bacteria. Okay, and then here's how I'm distinguishing, I'm saying without lung infection. I realize that you may have a lung infection, you can't get rid of it. But what you should know is that an anti-inflammatory diet has been researched and has been shown to be potentially helpful in people outside of the setting of lung infection. It's typically in the setting of things like Alzheimer's disease, cancer, heart disease, etc., diabetes. So, and in that setting, without lung infection, if extra weight and poor diet and other lifestyle factors like being sedentary or not getting enough sleep or being stressed, if those things are continually triggering chronic inflammation, then that's where an anti-inflammatory diet and other healthy lifestyle measures may help counteract what could be chronic low-grade inflammation that you may not feel. So just to be a little bit more specific, if you have a lung infection, you can't get rid of it, or if it recurs frequently, the main source there of the inflammation, whether it's acute or chronic, is the bacteria. Diet may play a supportive role, as I mentioned. It also may help reduce chronic inflammation that's related to other factors in your life. Maybe it's extra weight, although that's not very common with people who have chronic lung infections or illnesses. But maybe, maybe your diet can be improved, or maybe you could get a little bit more active or get better sleep or manage your stress better, in which case an anti-inflammatory diet could also be another supportive measure. But just know that it's really been researched and tested in the setting of these other chronic diseases in terms of Alzheimer's, cancer, heart disease, diabetes, and others. Okay, so let's then move to an anti-inflammatory diet and what that means. And there's two sections in here. I'm going to go over some topics related to how food and inflammation are connected, and then we'll look at diet specifics. And I hope to leave a lot of time for questions too and discussion. Okay, so the concept of an anti-inflammatory diet really is, there's an idea out there that you can adopt an anti-inflammatory diet, and that will help you reduce your body-wide chronic inflammation. And then this will directly lower your risk of specific diseases and improve overall health and longevity. Know that this idea has not been quote unquote proven quite yet. Although I have to say here that a lot of sources on the internet, a lot of books, a lot of people with a lot of credentials will say that it is. And I am not comfortable saying that. I feel very comfortable saying that there is a large body of indirect evidence that supports this theory, so much so that most experts agree that it is important, but they haven't gone so far as to say that there's cause and effect or that it's proven. So research does suggest, for example, that eating more fruits and vegetables lowers levels of CRP, which is one measure of inflammation in your body. So one of the ways that institutions can study an anti-inflammatory diet is they can look at features of an anti-inflammatory diet and then directly look at biomarkers of inflammation in your blood. And if they're linked, then the idea is that, well, maybe this is helpful in terms of lowering inflammation. Other studies that are done are observational, like this Journal of Internal Medicine study that was done in Swedish men and women. And they looked at a dietary pattern. Basically, those who followed a dietary pattern that was high in fruits, vegetables, whole grains, nuts, and healthy oils had lower risk of early death from all causes. They had a lower risk of death from heart disease and stroke, lower risk of cancer death. So there's a lot of this kind of evidence where dietary patterns are linked to lower risk of disease. Okay, so how does food lower inflammation? I wanted to start with one of the big kind of global things, and that is weight management. So we know that extra weight, especially if you're carrying body fat around your abdomen or your waist, we know that those fat cells there are metabolically active, and they may be producing and releasing inflammatory compounds inside your body, which is going to kind of trigger more inflammatory reactions from your immune system and potentially lead to chronic inflammation. So the goal is, if and only if you carry extra weight, consider trying to lose weight in order to lower chronic inflammation. The caveat here, of course, is that I typically will see underweight in patients who have chronic lung diseases or lung infections. And I don't want to encourage anyone to follow a very strict anti-inflammatory diet and then lose weight and get more underweight, because that's not healthful. Underweight in patients with chronic infections, as I've tried to say, is not desirable. It's related to a poor response to antibiotic therapy, to more disease progression, and to poor outcomes. So I'm okay with you trying to be healthy and eat healthfully as long as you can maintain a healthy weight. And sometimes that means you have to gain weight. And oftentimes when I counsel patients, I try and get them to eat healthfully, as healthfully as possible, but sometimes the goal is to gain weight with that, to try and reconcile healthy and weight gain. Okay. Other ways that food can lower inflammation. We know that certain foods can be high in vitamins and minerals, such as vitamin C, E, and selenium's a mineral. These are all potent antioxidants, and there are others. These are just examples, but they can neutralize what we call free radicals, or substances in your body that can be damaging. Basically, they can actually kind of quench them. They can make them become benign. So antioxidants are good, and those can be vitamins or minerals. We also know that foods contain phytonutrients. So most, if not all, plant foods contain plant-based chemicals. These are vital to the plant for their own life, but they're also nutrients or chemicals that are active in our own bodies. And so you may have heard, and this is not an all-comprehensive list, but you may have heard of some of these. So there's a lot of carotenoids. I would say some of the famous ones are beta-carotene, lutein, lycopene, and zeaxanthin. There's fiber, And that's part of the structural cells of plants, but it's active. It's actually physically active in our body in terms of promoting health. There are flavonoids, and I've listed some there. There's also resveratrol. So these are some examples of phytonutrients, but there are, there may be hundreds or thousands of phytonutrients that we know about now, and that list is expanding. So this is partly why a plant-based dietary pattern has kind of caught fire, that idea, because they're chock full of these phytonutrients that seem to have a lot of health promoting properties. Okay, another way that food can lower inflammation is that it can promote the growth of good gut bacteria. And these good gut bacteria can release anti-inflammatory chemicals into the body. On the other hand, you can have foods that actually promote the growth of not so good gut bacteria, and they can actually release inflammatory chemicals in the body. So what you eat has a very direct effect on your health. And what's interesting to me is that sometimes you don't necessarily feel this. I mean, in general, an anti-inflammatory diet should be associated with a sense of well-being, energy, good health, etc. But it's not always as perceptible as maybe would be helpful to get us to be incentivized to do this. Okay, so I wanted to point out some inflammatory foods. So these are things that number one, may not contain the helpful things that the anti-inflammatory foods contain, and also promote the growth of not so good gut bacteria. So processed carbohydrates. So these are foods that are full of very rapidly absorbed simple sugars and refined carbohydrates that tend to get absorbed very quickly. Then they very quickly increase our blood sugar, which then subsequently increases our insulin levels, because insulin is secreted in a dose-dependent way with the amount of sugar in our blood. And that can trigger inflammation, meaning higher blood sugar, higher insulin levels can trigger inflammation when they're elevated most of the time. So think of like breakfast cereal, juice, bagels, breads, chips, crackers, pasta, white rice, candy, soda. So if you're starting your day with processed carbohydrates, a lot of people eat breakfast cereal and a lot of people drink juice. And then you snack on processed carbs in between your meals, and you have more processed carbs at lunch, and maybe you're drinking soda or eating candy, or it can be this minute by, like all throughout the day, you can be setting yourself up for maybe less healthful interactions and more inflammatory responses in your body. Okay, processed meats are also a target. These tend to be highly preserved, either with additives or salt, which is sodium, or even other and then there are other compounds that are created during the processing, whether it's the smoking or the curing or the high heat. And all of these things could potentially increase inflammation. So I hate to target bacon, although I do like to say there is life after bacon. But a little bacon might not be a bad thing, but think about what you do every day. So bacon, deli meats for lunch, hot dogs, sausages, other salted, cured, or smoked meats. And it's particularly the red meats that seem to be bad. And what I mean by that is like beef or pork, so ham, are less healthful, potentially more inflammatory. Okay, other inflammatory foods are high-fat dairy, so not low-fat dairy, but dairy that's high in fat. So think of whole fat products, or other, like, cream products, whole milk, heavy whipping cream, and red meats are potentially inflammatory. So the link here, or the basis for this, is that they seem to be high in saturated fat, which may increase inflammation. So I'm targeting butter, cheese, ice cream, whipping cream, whole milk, beef, lamb, and pork. What I did not add, but I will mention here, is that, and it may be somewhat controversial, but I'm going to put it out there. So coconut oil and palm oil and other tropical oils that are highly saturated are also in this category. So the current thinking is that while there may be some benefits to coconut oil, certainly tastes good, that's my opinion, it seems to be on balance still not recommended. There are still too many potential harms with it that it's not recommended. Okay, so in terms of moving on to diet specifics, I'm going to give you a little bit of overview here. And one is that there is no template for an anti-inflammatory diet as of yet. What's more, a pattern is kind of what's more important at this time. And I've identified a Mediterranean style pattern as the best. It could be the Mediterranean diet, it could be the DASH diet, it could be what's known as the MIND diet, which is kind of a combination of Mediterranean and DASH diet. It could be a vegetarian diet or a pescatarian diet or something of that flavor, mostly plant-based with a lot of healthy oils. And we'll go through some of the specifics. So in terms of, sorry, another word on the diet pattern. There is something called the Dietary Inflammatory Index. It's a ranking of dietary patterns and certain foods and components of foods that have been studied for their inflammatory effect. This is a concept or an idea that came about in 2009 and has been used now in research since then. And what I'm about to tell you derives from the Dietary Inflammatory Index and how patterns, dietary patterns, and certain foods and components of foods have been linked to inflammation. So foods with a lower dietary inflammatory index tend to be anti-inflammatory. A higher index indicates more inflammation. In terms of higher levels of biomarkers in your blood, like CRP or ESR, in terms of higher risk for disease states, as well as higher risk of overall death. Okay, so one of the main features of a Mediterranean style diet is that there's an abundance of colorful vegetables and fruits. I'm starting with vegetables because I think I noticed that a lot of people eat a lot of fruit every day, but not everyone prioritizes vegetables. And so I try and encourage people to cultivate a taste for more vegetables. And I thought I could kind of talk about that as we go through. But in terms of how, so colorful vegetables are good, and then a large quantity. So 2 to 3 cups every day of a wide variety, colorful vegetables. Tomatoes have been identified as a food that, I mean, I think Harvard even says everyone should eat tomatoes every day. And this clearly is a potential conflict with reflux, so we'll address that. Just know that it's identified as one of the top anti-inflammatory vegetable foods. So one of the reasons they think this is true is that it's so high in lycopene. Lycopene is a phytochemical that has anti-inflammatory effects. Lycopene is fat soluble, which means it's best absorbed when it's cooked or paired with an oil like extra virgin olive oil. There have actually been studies done of lycopene when you either take fresh tomatoes and you mash them up and you put olive oil into it, you absorb a lot more lycopene and you get higher levels of blood lycopene when you do that. You also get even higher levels when you roast or cook tomatoes in oil, because it really breaks down the cells in the tomato and the lycopene comes out, is more accessible, and then the oil helps solubilize it so that it's absorbed into your body. The tomato intake has been, so that's the basis, or that's not the only reason tomatoes are good, but lycopene has been attributed to a lot of tomatoes' benefits. And additionally, tomato intake has been related to a reduction in IL-6, which is another inflammatory marker, not one that's typically done in clinical setting, it's typically done in the research setting. But so what I like to tell people in terms of reflux is tomatoes are a reflux trigger. So we want to eat them earlier in the day if we're going to eat them. We want to eat them in smaller quantities and ideally in less acidic forms. So tomato paste is super acidic. So if you can think of a sauce that's high in tomato paste, or pizza or lasagna that has a lot of tomato paste on it, that's going to be more problematic, in my opinion, than roasted tomatoes, or maybe tomatoes, fresh tomatoes that have been made into a fresh tomato sauce, where the acids have been cooked off to some degree, and it's a sweeter taste and it's a less acidic taste. So smaller portions earlier in the day, and then prepare the tomatoes in a way that they're not super acidic, and try not to combine tomatoes with other reflux triggers that might compound the problem. So I'm trying to come up with a way that you can include tomatoes in your diet, but not overdo it in terms of reflux. And I would always defer to your providers or your doctors in terms of how strict you need to be with reflux recommendations. I'm always trying to get people to add things to the diet that are helpful, but we don't want to do that if it's a really, really detrimental from a reflux perspective. And everyone has different situations with reflux. Some people have more severe disease that's not well controlled and reflux, and they have reflux, and therefore it's more important in that setting than someone who maybe has better controlled disease and less symptomatic, etc. But I would always defer to your provider on that one. This is just what I tend to tell people. And I try, like I said, get people to add things in and enjoy more foods than not. Okay, so moving on. In the vegetable category, yellow and orange veggies are also high on the list. So think carrots, squash, like acorn, butternut, kabocha, those are the yellow-orange squash. Sweet potatoes too, or orange, it could be yellow bell peppers. These vegetables are rich in vitamins A, B6, and C. They're high in fiber, and they're rich in beta carotene, which is a phytochemical or a carotenoid. Higher beta carotene intake is related to lower risk of all-cause mortality in studies. So the picture I have here is actually my absolute favorite carrot ginger soup that's made with cashews and fresh ginger and a lot of carrots and a little bit of onion. So that takes a lot more effort than just eating carrots potentially raw or roasted. Same with squash. You can roast squash very easily. You can blend it up into a soup. But sweet potatoes are easily baked or made into like baked fries. I don't know if you probably could do a sweet potato soup too, but what I try and do is I try and get people to think of, if eating things raw is always easy, it takes less prep. If you can just add these things in to make it easy, that's great. And then realize that there are ways to prepare them. So we want variety, and we want to add things like aromatics, like the garlic here in my soup or the ginger, and I've added cashews here. But you can really take something that maybe seems kind of plain or mundane, like a carrot, and turn it into something that's pretty seductive, in my opinion, like this soup. But even roasted carrots, they can get a little caramelized, and the flavor there is really good, and they're easier to digest. Okay, so we've got tomatoes, we've got yellow and orange veggies. Probably no one is surprised to see green leafy and cruciferous vegetables on the list of highly anti-inflammatory foods. So I listed some here. These are some of the big hitters. Arugula, which is a really tender, somewhat peppery green that I'll just make a big salad with arugula. And I might do just olive oil and a little vinegar on there, or maybe even just a little touch of lemon. Bok choy, broccoli, and Brussels sprouts. So I would do bok choy in like a broth. I would do broccoli steamed. I would do Brussels sprouts roasted. Cabbage, cauliflower, chard, and collard greens. Cabbage you could do as a slaw. Cauliflower you could roast or eat raw. Chard I will do in my egg veggie omelets. Collard greens, I don't do a lot of collard greens, but I have actually blended them in green smoothies. You can also just steam them and put them as a side dish. Kale. Kale I do in a smoothie. I massage oil into it to get it into a salad. I roast it occasionally, but mainly for me, it's like raw in a smoothie or in a salad, and there it's raw too. But if you massage some kind of vinaigrette into it, it actually helps kind of make it less tough and more chewable. Radishes, rutabaga, spinach, turnips, watercress. So I'm trying to emphasize here diversity and variety. Okay, Mushrooms are also called out as anti-inflammatory, and there's a lot of different kind of mushrooms. So there's shiitake, maitake, which you may have seen in stores. In the stores, there's cremini, there's white. These three have been called out. Mushrooms happen to contain a lot of anti-inflammatory phytochemicals. And so my favorite way to do mushrooms is I roast them with herbs, and I do mine not necessarily in a sauce or in a pan like this, but I put them in my toaster oven. So I'll do foil on a pan, I'll do parchment paper, and then I'll put fresh mushrooms, usually olive oil, and then I usually do rosemary on top of that. And it just takes 1 or 2 cycles of my toaster oven, and I've got mushrooms for the week. And I use them as a side to my omelets, or I put them in my omelets. Other than that, they go on pizzas. They go in soups and stews, and you can make broths with mushrooms as well. So I'm trying to kind of brainstorm some ideas. Okay, we're moving on to fruits now. And again, I'm calling out fruits that have been studied and where links have been shown to decrease inflammation. So probably no surprise, but berries are among the most anti-inflammatory fruits. And I should also mention, we're looking for quantity and varieties and color. So 1.5 to 2 cups a day is probably a good target. Notice that the recommendation for vegetables in terms of quantity is more. So fruits are good, but try and get more vegetables than fruits in a day. So berries are good because they're high in fiber, they're high in vitamin C, they're rich in plant pigment phytochemicals like anthocyanins and ellagic acid. They have potent antioxidant activity, and we have seen high berry intake be related to a lower risk of heart disease, Alzheimer's, and diabetes. So maybe what I'll say here is in season, like now in Colorado, in the States where it's summer and you can get fresh berries for a good price, I would say eat the fresh berries. And if you can, pick the strawberries organic if possible, because they're known to have high pesticide levels. But if you can't do fresh, or they're too expensive, or they don't seem to ever be good quality, it's completely fine to go with frozen. So I tend to have a big sack of frozen berries in my freezer like all year round. And they're very high quality fruit. And I will just take them out and put them in a glass jar and bring them to lunch at work, and they'll have thawed out by the time I get to them. Or I'll slightly thaw them out in the microwave, and so they'll be warm. So they'll be kind of like a warm berry compote. And I eat it plain, or I'll eat it with yogurt. It's a staple snack. Okay, apples are on the list. So they're rich in fiber, vitamin C, pectin, which is fiber, and polyphenols, which are plant chemicals basically. And it's those nutrients that are related to its anti-inflammatory effects and to the growth of good gut bacteria in animal studies. And there's a big variety of apples. I probably am guilty of just eating Gala apples and Granny Smith. So what I could do better is pick different varieties of apples. Stone fruits are on the list, and cherries in particular are really good, probably because of their phenolic compounds. But stone fruits are rich in fiber, they're rich in vitamin C, they're rich in potassium. Cherries, by the way, are another one of those fruits that you would want to pick organic if you can afford it and find it, etc. Cherries tend to have more pesticides than some of the other fruits. So I was at the store today, I made a point of picking organic cherries because they're in season, which is nice. I tend to eat seasonally as well because then you get really good high quality fruit, and it tends to be a good price, and it's fresh. Okay, so sticking in the fruit category, grapes, particularly red grapes, because they're high in resveratrol, are good, but all grapes are good. They're rich in fiber, vitamin C, and vitamin K. Citrus are also on the list. And these are your oranges, your grapefruits, your lemons, your limes. Another reflux trigger, I'll just acknowledge that. Citrus fruits are high in vitamin C, high in fiber, potassium, calcium, copper, and they tend to be rich in the phytonutrients that are the flavonoids and the carotenoids. And so given the reflux potential conflict, what I like to tell people is try and eat fresh fruit, eat it earlier in the day. Try not to overeat citrus, and balance it out with some of the other fruits that are not citrus that are also very good for you that we've just discussed. The apples, especially when they're in season, or the berries, or the grapes. Pomegranates are also really good. And these tend to be seasonal, so these tend to be more winter. They're rich in vitamin C and K and fiber, and high in the phytochemical anthocyanin and resveratrol too. So like, and maybe just another word on eating seasonally. So in the summer, I tend to look for berries. Later in the summer, I will look for melons and stone fruits, although stone fruits are good now too, some. In the fall, it's like apples. And then as it turns to winter, I'm thinking more citrus, more pears, more bananas, because there's always a staple there. Bananas are usually, you can get them good year round, or grapes at that time. Persimmons and pomegranates in the winter can get really good. So you're looking for dark red, you're looking for firm, and when you slice that fruit, you just see all the arrows, which are like the seeds, and that's what you're looking for. Okay, so I think that's it for the fruit category. So in terms of the other things that I wanted to call out, healthy fats are also a feature of the Mediterranean style diet. And so what I mean by this are fish that are high in omega-3s and ideally low in mercury. And so those are anchovies, salmon, sardines, and rainbow trout. Then there are other plant foods that are high in omega-3s, flax seeds, chia seeds, hemp seeds. So let me back up on the fish. I will make a point of eating fish at least twice a week. I probably eat fish more than that because I like it that much, but at least twice a week to get your omega-3s. And then flax, chia, and hemp seeds, I will put on my oatmeal every day. Although I've got to do ground chia because I don't digest the whole chia very well. Other nuts and seeds are also considered very healthful. So almonds, pistachios, walnuts, and I would say others, but those happen to be to stand out. Pumpkin seeds, sunflower seeds are also good seeds. And in terms of oils, extra virgin olive oils is called out, but I am okay with a variety of other unsaturated plant oils. Those are oils that are liquid at room temperature. It could be avocado oil, it could be sunflower oil, it could be sesame oil, etc. Legumes are also a big feature of a Mediterranean style diet. And what I mean by this are beans. So think black beans or chickpeas or pinto beans, dried split peas or lentils. And most people that I meet who live in America, they don't eat a lot of legumes. And so this is an area where I think most people can try and improve, try and cultivate a taste for dishes that contain beans. And an easy place to start for a lot of people is like refried beans, like black bean refried beans or pinto beans made into refried beans. And if you haven't made your own refried beans, they are absolutely worth it. And they're so easy and they're so cheap. So you can basically, I've been craving these, you can take, and I haven't made my own beans from dried yet, but you can get no salt added canned black beans, for instance. And I try and get them in containers that don't contain BPA. Then I rinse them. And then you can just saute up some onion or shallot with garlic. And then put in a little seasoning like cumin, something real simple. And then add the beans and kind of mash them in. Stir them until they're mashed and warm. And oh, it's really good. So refried beans, most people that I meet are friendly towards refried beans. So I try and push those. But it could be, it could just be a bean burrito, maybe with some bell peppers or chicken. It could be split pea soup. It could be lentil soup. Something simple. Whole grains then are another big category that are common on the Mediterranean style dietary pattern. And I try and get people to I try and push them out of their comfort zone. Most people are pretty familiar with like brown rice or oatmeal, maybe quinoa too, although that's technically a seed, but we can put it in the whole grain category. So I try and get people to start with that. So, move aside the breakfast cereal, put in oatmeal or another whole wheat cereal. Try and do a little bit less white rice, or at least balance. Do some white rice and then do some brown rice or wild rice or other type of whole grain rice. Consider using a different flour if you're baking. Maybe use more whole wheat flour, 50-50 with your white flour, or add amaranth flour, which I think is lovely. You can also do barley in a soup with mushrooms, etc. Rye is also another good one. So other than whole wheat, you could do a whole rye bread. And then most people want to know about herbs and spices. And this is another area that I think a lot of people could work on. Adding fresh herbs and spices, especially when they're in season, or doing a lot more dried in order that you get flavor and that you get some of these active compounds in the herbs and spices to help lessen inflammation in your body. So I put them in alphabetical order there because I'm a little OCD, but we've got basil, bay leaf, black pepper, and maybe just to stop, I will do basil on a salad. I will do them on tomatoes. I will do it in my egg omelets. I will make pesto, fresh pesto, and put that on vegetables as well as chicken if I'm doing sandwiches or just side dishes. Cinnamon, clove. I do a ton of cinnamon in my oatmeal every morning on purpose. I put clove on my yogurt as a snack. Cocoa also, and I forgot to add my chocolate slide. But cocoa is high in flavonols. And so something I've gotten, actually, what I enjoy doing outside of the winter months is I will freeze bananas and then I'll mash the bananas up and I'll put cocoa powder with it. And it's like a dessert. And you can also make popsicles like that. You could do like bananas and cherries, maybe throw in some spinach and then toss in some cocoa and freeze it up, and it's delicious. Coriander is like the dried form of cilantro, or the fresh form would be cilantro. So I put cilantro on almost everything. I put it in hummus. I put it on my salad. I put it with Mexican dishes that I make. Dill, I will do fresh. I put that on Greek dishes or fresh on salads. Fennel, you can get that fresh, and that's delicious in salad. Just slice it up. You can also roast that. Garlic, everyone knows. Ginger, people know. Lemongrass has a really just a potent lemon flavor. Mint is a reflux trigger. So is cocoa, by the way. So think smaller portions earlier in the day. Try not to compound triggers. But mint, think of like fresh mint. You could do that on fruit. You could do it in smoothies. Nutmeg, I do in oatmeal. Oregano, parsley, red chili powder, rosemary. I do a lot of rosemary and thyme on vegetables. Sage, I do in soups, like the butternut squash soup, for instance. Saffron, turmeric. And I will do turmeric and ginger in things like lentil soup or curries or stews. And finally, beverages. So coffee and tea, green and black in particular with tea, and wine in moderation are also considered healthful because they contain these phytochemicals, antioxidants or flavonols that may be beneficial. And then I'll show you some of what I haven't added here because I ran out of space was fermented foods. They aren't necessarily listed in every reference that I've looked at for anti-inflammatory foods, but I think fermented foods, I feel pretty comfortable, like particularly yogurt, but there are others, are helpful. And so I have a gallery that will kind of show the yogurt anyway, but that's where yogurt fits in. I am good with probiotic foods. Okay, so just to finish up then, the idea is to enjoy your beverages, coffee or tea, wine in moderation. You could enjoy for breakfast oatmeal with fruit or with nuts or seeds and certainly some spices. You could do eggs with veggies and maybe a whole rye bread and some fruit on the side. You could do toast, and this is French toast, but you could do toast with a nut butter and a lot of colorful fruit. You could snack on nuts, and again, think variety: Brazil nuts, almonds, pistachios, hazelnuts, pecans, walnuts, cashews. And here's the yogurt slide, my little tribute to the probiotic foods, but yogurt is by all means not the only probiotic food. But a low-fat yogurt, particularly a Greek yogurt, I would recommend it because it's high in protein and it's low in fat. Now, if you need to gain weight, I'm okay with adding some fat here. And then add that with some fruit, maybe have it with some nuts. or do a whole grain muffin with fruit. And I would probably consider putting some almond butter or peanut butter on these cranberry muffins. Okay, this is hummus. This is my lunch on a regular basis. This is actually in my house. That's my hummus. This is lentil soup. This is my ginger curry lentil soup, which is the great thing about lentils is they're soft and they cook up really quickly. This is a salmon with some green vegetable and pomegranate seeds. These are scallops. So other seafood, you should enjoy fish and other seafood at least twice a week. And this is a salad. And you could do spinach with strawberries. The strawberries are high in vitamin C, which helps you absorb some of the iron out of the spinach. There's also some mint leaves here. This is a chicken dish with some kale on the side and more pomegranate arrows. And then enjoy dessert. And I think one of my favorite desserts is a small portion of a dark chocolate that's at least 70% cacao, and maybe some fruit with that. So I've added my references here. I've picked a couple just from Harvard. I tend to overlap these with some other references I've looked at, but these are the two main ones. And this took longer than I thought, but that concludes the presentation. I'm happy to take questions.
Thank you, Michelle. We have some questions in the queue, so let's jump right in.
Okay.
First question, if you are pre-diabetic, how do you get those extra calories in to keep your weight up?
Okay, so without eating a ton of sugar is kind of where I think this question is going. So if you're concerned about your sugar levels, there's a couple of things I would say. One is carbohydrates are still okay. You'd want to pick a good quality. So pick a whole grain carbohydrate and then so for instance, oatmeal. And combine that with, so do maybe a little bit less oatmeal, but combine that with a lot more nuts or seeds in order to get the calories from something like the nuts and seeds, which are high in protein and healthy fat, and therefore calories, without getting just a pile of carbohydrates. And when you combine them like that, the nuts and the seeds and the healthy fats in those nuts and seeds and protein will slow the absorption of the sugar from the carbohydrate when you absorb it. So that will also reduce your risk of having blood sugar spikes and progressing prediabetes to diabetes. So pick a good quality carb in summary, and then eat the carbohydrate in combination with other foods that are high in protein and healthy fats to get the calories and get other nutrients, and slow the absorption of the sugar, and moderate your portion of the carbohydrate food. That's my answer on that.
And a somewhat related question asking about the Mediterranean diet. If you have to gain weight, how do you modify something like the Mediterranean diet if you need to put on weight? Right.
So I immediately go to the higher calorie Mediterranean style foods. So think nuts and nut butters. And when I see people now, I tell them a cup of pecans is close to 900 calories, a cup, which is not very much. You know, think of like a mug. So nuts and seeds, nut butters. So if you have trouble with the whole nut, or if it's hard to chew or whatever, do more peanut butter or almond butter or something like that. Think avocados, and then any kind of chicken or fish that you can, or vegetable potentially, that you can cook with olive oil or another unsaturated plant oil. So do a good portion, 4 to 6 ounces of chicken, fish, or other meat. Maybe pan fried a little bit, or put pesto on the chicken, or drizzle olive oil on it. And then when you're eating it with vegetables or a grain or starch, add fat to the grain or starch. So I would take olive oil and I would stir it into the rice, or stir it into some pasta. Or I would, with the vegetables, I wouldn't eat a lot of raw vegetables before the meal. I would eat the vegetables with the meal, and I would eat them, vegetables that have been cooked in oil. I would saute them or roast them or grill them, but get them to soak up that fat. A tablespoon of olive oil is 120 calories. That's a lot. So I focus on nuts and seeds, nut butters, avocados. I focus on adding oils and eating your protein foods, like your chicken or your fish or other seafood. And even if you're going to do legumes, add oil to them. You know, you can, when I make hummus, I put oil in the hummus and then I put oil on top of it. And so I'm conscious about adding more fat to the food. And then, of course, if weight gain is really a priority, it is okay to enjoy some of these things that are less Mediterranean, but that are higher in fat, especially if you like butter or if you like ice cream. And I'm being serious. If your main issue is that your body is too underweight and too weak to fight the infection, then that's your priority. You've got to prioritize the weight gain, because a Mediterranean style dietary pattern is not going to help you if your body is so weak that it cannot mount a strong enough immune response to fight the infection. Your primary goal, so you have to prioritize. Your primary goal might be weight gain, in which case, you know, eat healthy foods, but eat the higher calorie ones, and be okay eating some of the less healthful foods in order to pack in some of the calories. And you can always eat those foods after you've had your nourishing meal, to kind of prevent the blood sugar spikes, et cetera, et cetera. But you may need to really liberalize your diet to restore a healthy weight.
So we have a question about processed carbs. What if the bagels are whole wheat? Is avoiding them still recommended?
So, I mean, I eat whole wheat bread. I don't eat whole wheat bagels because I'm just too lazy to go to the bagel shop and get bagels. And probably there's too much dense carbohydrate in that bagel for my preference. I'm not that active anymore. But so a whole wheat bagel is better than a non-whole wheat bagel. Oatmeal is better than the bagel. So I'm not going to tell you not to eat the whole wheat bagel. I'm just going to say that maybe you could try and, in other words, enjoy, if you like whole wheat bagels, go for it. That's gonna be better than the regular bagel, but then try and add some less processed grains or starches into your diet to kind of counteract the bagel. So what you do on most days matter. If you have bagels on the weekend and you eat differently during the week, then that's the minority of what you're eating, and that's okay, in my opinion. That can be worked into something, to a healthy dietary pattern. And I think maybe I'll take this moment to kind of just say, don't necessarily focus on a specific food, focus on the pattern and what you eat most days. That's what's most important. So a bagel, even if it's not whole wheat, could fit into that pattern, as long as it's not what you're doing most days or every day.
Okay, we have a question about veganism. Somebody wants to know if it's better to be vegan.
Okay, so I think it depends on your goal. If you're vegan and you can't maintain a healthy weight and you're struggling with your infection, that's a problem, in my opinion. If you're vegan and you're a healthy weight and you have a history of heart disease, and you're trying to manage your heart disease risk with a vegan diet, I would say maybe that's a good application for it. So it really depends on what your end goal is. I think if you're comparing vegan versus Mediterranean, I would say they're both probably healthful. Although vegan, you've got to be very mindful about meeting your nutrient needs, because vegan diets are missing some key nutrients that you need to make sure you're getting, either by supplementation or by specific food intake. But they're probably both very healthful. And I'm going to extend this a little bit. Vegetarianism is very healthful too. The difference is essentially what you can stick to and what makes you happy. So I would actually argue that they're both fairly healthful, as long as you can maintain a healthy weight and meet your nutrient needs. And if it works for you and you can sustain it, then I'm thumbs up on it. So I'm hedging a little bit there, but it to some degree, it depends on what you're own personal health situation is.
We have a question about, I guess it's laryngopharyngeal reflux. If they're not experiencing like heartburn symptoms such as you would have in GERD. So if they don't feel reflux symptoms, can they have tomatoes or other trigger foods?
That's an interesting question. Okay. This is a dicey question. So what it comes down to for me is, are you potentially having episodic reflux, even if you're asymptomatic, that's coming not just from, your upper area? Because one could argue that tomatoes may promote episodic reflux, which could be problematic. So I honestly, to play it safe, I probably still want you to moderate, unless you were really struggling with gaining weight and tomatoes were an easy vehicle to help you gain weight because you really liked a bunch of foods, whether it be chili or other tomato-based foods that might help you gain weight. Again, it's hard for me to make generalized statements, but I tend to flex when I want people to restore weight or put on weight. So I think what I'm saying is, I think tomatoes might promote episodic reflux, even if you're asymptomatic. And it's helpful when you've had the testing to know whether or not you have any reflux, but a lot of people don't have the kind of gold standard tests. So we don't necessarily know. So then we're guessing. And in the situation, I think where we're guessing, to increase your margin of safety, being more moderate is still appropriate.
Okay, we have a few more questions to go through. We have a bunch of questions about recipes. So people want to know if you have any good recommendations for cookbooks and for recipes. And also they want a couple of the recipes that you mentioned. We would like to have your ginger carrot soup recipe, please.
Okay, I can give that to you. Cute.
But where do you find your recipes though?
So let's see. I tend to be a bit eclectic. So, and I've been collecting recipes since I was in college and trying to teach myself how to cook. So I've used cookbooks, which are the traditional cookbooks, traditional magazines. I've also gotten a lot of recipes from people. If I eat something that I like, I ask for a recipe. If I'm at a restaurant and they're willing to share, I'll ask for the recipe. So I've kind of collected things like that. Nowadays, I get probably the vast majority of my recipes online. So there's a lot of blogs and there's a lot of social media sites that have ideas and have recipes. And I've gotten to the point where I know what I like and I know how to cook enough that I can look at something and know whether or not I'll like it. And I also can look at something and know how I might want to modify it to get it so that I like the taste of it. So I use a lot of recipes that I find online. And the key with the online stuff, in my opinion, is if you don't know what you like already, look at a recipe and look at the reviews and go for recipes that have a lot of reviews, and there are a lot of excellent reviews. So, 4.5 stars or above. Those tend to work well. That's been my experience.
Okay, somebody's asking, what is a good substitute for coconut oil?
So coconut oil is a high heat oil. So you could pick an avocado oil or a sunflower oil. I actually am forgetting the smoke point of those oils, but oils have a smoke point, which is the point at which they start to smoke and break down. And in general, you don't want to use an oil in general, you do not want an oil to break down on you when you're cooking, because that can be unhealthful. So if you want to cook high heat, like using coconut oil, for instance, You could substitute with an avocado oil or a sunflower oil. Those would probably be my top two. There probably are other higher heat oils, but those are my two go-tos.
Okay, is whole wheat pasta okay to eat once a week? And somebody else wants to know, is fresh orange juice, they drink fresh orange juice every morning. Why is it not healthy?
Okay, so whole wheat pasta, this kind of reminds me of the whole wheat bagel question. Yes, I'm fine with pasta. Let me be clear, I'm actually fine with regular pasta, which is refined, um, as long as you're not doing it most days. Is whole wheat pasta better? Yes, if you like it and you still want to eat it. And once a week is fine. Um, so, and if you're going to do pasta and you're concerned about it being processed, then combine it with vegetables or chicken or some other protein in the sauce so that your body doesn't rapidly absorb that pasta that you're eating. It tends to be more slowly absorbed. So yes, I am okay with pasta, particularly if it's not your staple go-to every day. And whole wheat pasta is better if you like it. And then the freshly squeezed orange juice. So the issue with orange, so the fact that it's freshly squeezed is good. I'm not gonna lie there. The issue with the orange juice though, in this situation with freshly squeezed, may be two things. And one is that to come up with a glass of juice, you're gonna end up using a lot of oranges, like more oranges than you would normally eat if you were eating whole oranges in one sitting. So you're getting a lot of fruit, and you are probably getting, assuming you're using the pulp from the fruit, you are getting the fiber there. But if you get the juice from any fruit, and in this case you're getting a lot of fruit, then more than you would normally eat in just kind of a natural setting of eating whole fruit, and then you put it into a glass, it's liquid, so you very rapidly absorb it. So that's the issue. It's the rapid absorption of it and the quantity, as I mentioned, with the number of oranges you're probably getting in one glass. And the rapidity of absorption of that sugar from the juice, you get a spike in blood sugar and then you get a spike in blood insulin. And when you have that chronically throughout the day, because you're eating a lot of processed foods in the context of eating a lot of other processed foods, that might lead to a hyperinsulinemic state, which is inflammatory. So if you want to do fresh orange juice, I would say freshly squeezed orange juice, do a small glass, 4 ounces or less. I would never do any more than 4 ounces of juice unless you really need to gain weight. But from an anti-inflammatory perspective, keep this portion small and drink it either toward the middle of your meal, which consists of a mixed meal ideally, or towards the end of it, so that your body's kind of working through the good food and nourishing food that you've eaten. And then when you layer in the juice, it will be more slowly absorbed.
Okay, what about cantaloupe and watermelon?
Okay, so right, I didn't necessarily call out cantaloupe or watermelon, but I would argue that both are going to be good. And the foods that I listed aren't necessarily an all-inclusive list of anti-inflammatory foods. They're just ones that have been looked at from a dietary inflammatory index perspective and tend to be more researched. But I could very easily argue that watermelon is anti-inflammatory because it's a plant-based food, it's a whole food, it's high in lycopene, like tomatoes, as well as other vitamins and minerals. So I'm good with watermelon. Cantaloupe is very good because it's one of those yellow-orange, it's got that coloring, which we know is really good with vegetables. You're going to get some similar phytochemicals in the fruits that are those colors. And we know, I mean, just pulling, I know melon is very high in potassium, which in general is very healthful. So I would recommend those, especially when they're in season later in the summer.
Okay, so we have somebody who they were asking about cookbook recommendations. So I think you gave them a good idea about going to the internet to look for some. But they wanted to know about recipes to help them stay interested in food to keep their weight up. And specifically for desserts. Do you have any recommendations for desserts to help them with that?
desserts to keep the weight up, is that what you're saying?
Yes.
That's an interesting question. I mean, honestly, okay, so let me break this down. Cookbooks to keep your weight up. I don't know any off the top of my head. You know, one thing that you could look for in a recipe, because a lot of times when you're online or in a book, they give you the calorie content of it, but you'd be looking for a meal that's over 500 calories, you know, somewhere between 500 and 800 calories per meal. That would be a good high calorie meal, or more for that matter. And then, so cookbooks. Yeah, I tend to resort, so sorry, let me just comment. I don't have necessarily a cookbook recommendation for weight gain because I try and make it a little bit more practical in terms of just trying to get people to look at their baseline diet and then figure out how to layer in more calories on a daily basis. And a lot of times when people are having trouble gaining weight, they can't eat large volumes. So I try and find small incremental ways to get them to get their intake up. And just to rely back on what I said, that's a lot of nuts, nut butters, oils, avocados, and other foods, granola, where you're gonna, in a small volume, you're gonna get a lot of calories out of it. In terms of desserts, what I want to say is if you're really trying to gain weight, you should eat the dessert that you like the most because you'll eat the most of it, regardless of what it is, including even if it's chocolate. I know chocolate is a reflux trigger, but if you like a chocolate dessert and you want to tack it on to the end of a meal, I would put a stamp of approval on that. And my goal is, I've just seen weight gain be such a struggle for people that I try and find the path of least resistance. So again, like if you like ice cream, and most people do, then I go that direction. I would just put it on at the end of a meal. Get your nourishing meal in first, and then add in the ice cream, because everyone has space for that. If you don't like ice cream, I would pick a dessert that's high in fat. So not like a gelato and not like a low-fat yogurt, because you're not going to get much mileage out of that. So most desserts are high in fat, but not everything. Like don't pick candy, for instance, because you're not going to get a lot of mileage out of that. Pick something like an ice cream or a cupcake or a donut or a piece of cake, or a custard for that matter, that would be high in protein. Because then you're going to get more calories out of the fat from that dessert. So yeah, that's how I'll answer that.
And just a quick follow-up on the nut butters. Peanut butter is included in those nut butters. And
Yeah.
somebody was asking, is it terrible if it's not, you know, organic peanut butter or natural peanut butter? They just have regular peanut butter.
I know. So no, it's not terrible. Most peanut butters, okay, so partially hydrogenated fats, which were the source of most trans fats in the diet, have been banned in the United States since I think January 1st of 2020, or potentially earlier. I thought it was earlier, but I just read that that was the official date. So there are no longer partially hydrogenated fats in peanut butter. The more generic or store brand peanut butters, though, may contain hydrogenated fats, which I think the healthfulness of that may be a little bit questionable, but honestly, you're probably not eating that much peanut butter for it to make a difference. You know, even if you had 4 tablespoons a day, it's still not that much hydrogenated fat. So bottom line, I am okay with peanut butter, even if it's not the high-end boutique-y, all natural peanut butter.
So we have a couple of questions about tofu, and particularly for vegetarians and vegans. That seems to be a staple of their diet. So they're asking, you know, is there an issue with eating tofu? Is that, you know, is that good to eat? You know.
Yes. So I like tofu. I think it's great to eat. It's a good plant-based source of protein. You may need to add calories to it. Again, I'm erring on the side of trying to make it a little bit heavier. So maybe saute it in some olive oil, marinate it in garlic and ginger, and then saute it in some olive oil to get it crispy or something like that. But yes, so I'm a fan of tofu. I think it's a relatively unprocessed soy-based food that's a good protein source.
And what about corn? Somebody wants to know your thoughts on corn. They specified non-GMO whenever possible, but they're asking about.
Yeah, so a lot of people think corn, well, so corn might be one of those, so whole corn is going to have quite a bit of fiber and will be less or more slowly digested than like a processed corn, like a tortilla. So if you're talking about an ear of corn, I think it is a starchy vegetable. It is somewhat rapidly absorbed just by itself, even in the unprocessed form. But I think because it's a whole food, it's good to include in your diet. I would just say, you know, make sure, again, depending on if you need to gain weight. If you need to gain weight, I'm going to tell you to eat more corn and put some butter on it probably. But if you have a healthy weight and you're trying to maintain a healthy weight, enjoy some corn, but do that on a plate that has a lot of other non-starchy vegetables and a good lean protein, and then it's fine. So I'm actually good on corn, even though it's sweet and starchy.
Okay.
Oh, you're muted.
Better?
Yeah.
There we go. Somebody's asking, if you have an immune problem and your body has trouble fighting inflammation, would a diet like this possibly be beneficial?
Right. I think the answer is yes. I just don't want I don't want to overpromise its benefits. And so I do think it can be supportive as long as you can maintain a healthy weight. But it sounds like there's an underlying process that's causing the inflammation, and that probably can't be fixed with the diet, but the diet may be supportive for it as long as you can maintain a healthy weight.
Do you have any thoughts on Greek non-fat yogurt versus low-fat yogurt? Somebody's been eating Greek yogurt daily for calcium and the probiotics. So what are your thoughts on the yogurts?
I'm okay with non-fat and low-fat, which tends to be 1% fat or 1.5% fat, or maybe even up to 2% fat. I'm okay with either. And, you know, there's not that much saturated fat in low-fat yogurt for it to be a huge issue. So I personally prefer a little creaminess in my yogurt. So I use I think I use Wallabies organic, low-fat Greek yogurt, which I think is 1 or 1.5%. And I prefer that to the non-fat because it's just a little bit creamier. And I don't think that the harms outweigh the benefits there. I'm okay with either, let me state that, but I don't think the low-fat is dangerous per se.
And we have a question, what other foods are probiotic besides yogurt?
Right. So, well, let me just say this. Kefir is a drinkable yogurt, or, you know, it's more liquid form. That's actually one of the foods that has one of the highest amounts of probiotics in it, even compared to sauerkraut. So if you like dairy, kefir may actually, if you're going for probiotics, kefir may actually be better than yogurt. But other than the dairy, you could look at, I mean, I think of sauerkraut, I think of other pickled foods, or some other probiotic foods. Why am I blanking on this? I guess I think of pickled foods. I think of sauerkraut. I think of yogurt. There are some drinks, like there's kombuchas, which unfortunately those are all often carbonated, but you can get fermentable drinks. I mean, I think of vinegars too, which again, there's a reflux trigger there. And I'm not coming up with a lot of other foods right now off the top of my head. You have any you can add for me?
I don't off the top of my head, but I'm sure as we go down the road, we will be adding information to our website about this, and we will make sure we add in lists of probiotic foods. So we have a question about sweeteners. The question is, what is your opinion about erythritol and monk fruit sugar substitutes? They're supposed to have no carbs and don't raise blood sugar. Are they good for an anti-inflammatory diet? And how do we address this for people who don't have any problem with weight gain?
Okay, let me just say, so I actually want to, if we could maybe put this question on hold. I hate to say that, but I would go, so I have a couple of sources to check for the safety of additives. And I haven't looked up monk fruit and erythritol. So I actually I don't have an answer on that, unfortunately. But so what I'll tell you maybe is if you want to tune into one of my other webinars, there's one regarding sugar. I could address it there. If you want the answer now, what I would do is go on to Chemical Cuisine. It's an online resource put out by the Center for Science and the Public Interest, and they rate the safety of food additives, including sugar substitutes. And it's a really good source of information. So that's actually exactly where I would go. And I don't know what they say, but I would go based on what they say. And then the second part of that question was, how do we deal with this for people who, what was that, don't have an issue with weight gain? Is that what you said?
This person was asking the question simply because they don't have an issue with weight gain. So I guess that was why they were asking.
You mean they don't need to gain weight?
Right. They don't have a problem gaining weight.
Right. So it sounds like,
with that.
Okay. So it sounds like they don't necessarily want to gain extra weight. That's what I'm presuming. Yeah. So then what I would just say is, I'm aware that Chemical Cuisine ranks stevia as among the safest sugar substitutes. So I don't know if you'd like the taste of that or not, but that's something that I routinely recommend. So when people want a sugar substitute, I opt for stevia. Sorry, I don't have information on the monk fruit and the erythritol, but I would refer you to that online site.
Okay, we did. I did note down the name of the person who asked the question. So if you come across other information, forward it to me, and I will make sure that question gets answered. And then hopefully during your upcoming webinar on blood sugar and diabetes, we can get more information about that.
Okay. And you're muted again.
Okay. And here I am. A couple questions about eggs. How do you feel about eggs? Where do they fall into the anti-inflammatory foods?
Oh, that's a good question. That's a good question. I guess let me say this. Eggs, what I have noticed is in my readings about the Mediterranean diet or the Mediterranean dietary style as it is anti-inflammatory, eggs tend to be left out. And so what I take from that is that they're somewhat controversial. I think there is some evidence that links egg intake with chronic diseases such as diabetes, believe it or not, more so than heart disease. So I think the verdict might be out a little bit on that. What I can tell you, I also don't want to make people afraid of food, particularly the benefits of eggs are that they're a good source of complete protein. They're easy to make in a variety of different ways, and they're cheap, among other things. And they're high in nutrients. I mean, the egg yolk is high in choline, which is hard to get other rich sources of choline. And so I like the I like eggs. I like eating the whole egg for the iron and the choline that's in the yolk, among other things. And I actually eat them regularly. And as far as I can tell, it's not negatively affecting me in the sense that my inflammatory levels are not elevated. I haven't demonstrated a chronic disease in terms of heart disease or diabetes. That seems to be progressing. So to some degree, you have to personalize these things and weigh the benefit versus the harms. And I think for a lot of people, the benefit of eggs is greater than the potential harm. So I tend to recommend eggs. Now, if you have if you have a lot of heart health risk, I will probably recommend you do more egg whites than egg yolks. But I would just recommend you limit the yolks. You don't necessarily need to avoid them altogether. I hope that addresses that question. And you're muted.
Thank you. So what if you're trying to gain weight, but you're also dealing with kidney stones and they tell you not to eat nuts and certain other foods? What do you suggest for weight gain?
Whoops, sorry. Okay, let me think about this. So the issue is that nuts are bad for kidney stones. Is that what I'm hearing? Okay, so, and I hate to do this because I don't know anyone's specific medical condition, but I would, number one, question the recommendation, meaning please make sure that that's a legitimate restriction, because as far as I know, nuts generally are not restricted with kidney stones. So I don't know your specific situation, and with all due respect, I don't know your specific situation, but I always want to make sure people are not restricting unnecessarily. So double check that. If you can't do nuts, then rely on the other things, whether that's your avocados or your chicken, fish, or meats that with added oils, your vegetables with oil, with added fats, your grains and starches with added fats. You may need to rely on more high-fat dairy, meaning, you could do more cheese, you could do more of the, whether it's higher fat yogurt or other high-fat dairy. What else was I thinking? I just lost my train of thought. Granola, anything that's made with baked or made with fat's going to carry a lot of extra calories. So look at the calorie count on your foods and try and aim for things that are higher. And I don't know if you can do seeds, I don't know if it's just nuts. And again, make sure the nuts are legitimate. But then look at maybe some doing other seeds. You could do sunflower seeds, you could do pumpkin seeds, and the flax, the chia, and the hemp, concentrated forms of calories to get extra calories.
And we have one final question. They're asking about carbonation. Is it a bad thing if you don't have reflux, as in mineral water like Pellegrino?
Right. So, and I'm going to hedge here a little bit, but I would argue that probably everyone has episodic reflux. So carbonation is one of those things that does contribute to reflux. Of all the research that's been done, carbonation is one of those triggers. So I think it's probably prudent to be mindful of being moderate with it, drinking it earlier in the day and trying not to do a huge portion. I'm still going to recommend moderation with that, but that doesn't mean full-on elimination. It just means being mindful about how you include it.
Thank you very much. Michelle, I think we've finished about all the questions. I really appreciate you taking the time to be with us today. This was a wonderful first webinar for our series, and we are really looking forward to the remainder of them. Everybody, thank you for joining us, and we look forward to seeing you again next month.
Thanks, Amy.
Thank you. Bye-bye.
Bye-bye.